you have anything to add to that, or is that pretty? Does that sum it up? Cost of healthcare. First of all, one of the interesting visits that I had this afternoon was a great small business in New Hampshire. It's actually a business that's been around for about 27 years, and it located from Massachusetts to New Hampshire, which we like that. And we'd like to obviously see more of that. But the company is a medical device company, and so they produce braces. So if you hurt your knee, the brace, the arm, all of the type of brace activities that would be a medical device. Under the Affordable Care Act, which was the Health Care Act that the President championed, that in my view is the wrong approach for our country, because we're continuing to see it didn't address the issue of health care costs. It purported to extend access in a one-size-fits-all federal answer without addressing the issue that I showed you up there, the cost issue, because healthcare has continued to go up and up. I wanted to bring that example to you because of this. Just in that Healthcare Act, there are multiple tax increases that are coming to pay for it. And one of them is a medical device tax. And it's going to hit this company I visited this afternoon. It's a tax on revenue, not profit. And when you think about a tax on revenue is a tax, if you're a new business, you don't even make a profit. This company is a profitable company. When the medical device tax goes into place, it will no longer be a profitable company. So why do I raise this with you? We want more jobs. We've got to stop passing things like this from Washington that actually put successful businesses out of business and hurt jobs. Second, if it costs us more, this company has two choices. Either restrict or try to increase the price of its product that it sells to all of you. Well, what's that going to do to healthcare costs? It's going to increase healthcare costs. So we have to stop doing things from Washington that will increase healthcare costs. But there are some things we could do that help increase the competition in the market of healthcare that we could do, in my view, that would help reduce costs. Number one, if you're a business in New Hampshire, or an individual, you have about 3 choices of health insurance companies that you can pick from. Because health insurance is regulated state by state by state. When I want to pick a driver's motor vehicle type insurance, I can go across the country. I can pick between thousands of insurers. We should do that for health insurance. If you're an individual or a business, you should be able to pick not just from the 3 that are operating in New Hampshire, but any health insurance company that's operating anywhere in this country. And the insurance company should have to compete like other businesses across state lines. And we could do that tomorrow in Washington and make more choice and force competition there in the way a market is supposed to operate. Second, we should allow people to pull together. We should allow smaller businesses to come together under trade associations so they can get the big rates of the bigger businesses. We should allow that buying power to work for smaller businesses and individuals. And also, I think we need to reform our litigation system, because I've talked to so many of our physicians. There are people that are legitimately injured, but there are many claims that come forward, medical malpractice claims. So our physicians feel they have to practice defensive medicine instead of focusing on caring for you. And that has to change. So those are 3 things I would do right away to help reduce healthcare costs. And I would vote, and I have voted, to repeal the Affordable Care Act, because I don't think it's